Thank you for listening to this St. Louis on the Air podcast brought to you by Lindenwood University's Hammond Institute for Free Enterprise. Examining market approaches to help solve economic and social issues, hammond.institute.
Welcome to St. Louis on the Air. I'm Don Marsh. You may have seen our health reporter Sarah Fenton's report last week in which she revealed that life expectancy rates are decreasing here and across the country, largely because of the opioid epidemic. More people are dying, young people are dying. That's something that a new Washington University program is hoping to change. The university's Brown School has launched the Community Academic Partnership on Addiction, or CAPA. It's taking on the opioid epidemic and other substance use disorders. Brown School professor David Patterson Silver Wolf is an expert on substance abuse treatment services and is chief research officer at CAPA. He joins me in studio. David, thanks for coming in. Great to see you.
Thank you so much.
Well, tell me what CAPA is and how it works.
Right. So CAPA is a partnership between a university and a community program, and we're used to having these models. If you think about BJC, they're a partnership with WashU's Med School. And so that's a teaching and learning and research hospital where lots of research is done. Interns work alongside of senior folks. And so this is a model based off that. And so unfortunately, while the university hospital and medical school model is sprinkled all across the country, social work programs don't have this model. And so this is a great opportunity to embed master level, PhD level social workers to get trained specifically in this crisis that continues on.
How is that going to help the addict on the street?
Right. So I think, fortunately, it'll bring science, the latest science and technology and innovation to this problem. This is a tough disease to treat, and so getting in-depth, on-the-ground, real-world training early on, while you can also direct your education, is very important.
Well, is it going to deal with the addiction itself? That is, I'm trying to find a way to phrase this that will make some sense. Getting to the person on the street who has an addiction, is it going after the drug itself or after the addict?
Well, we don't. So we try to treat the whole disease, the whole person, and. So this illness, it's a brain disease. It's a chronic illness. Imagine you have a loved one that was diagnosed that they had cancer. And the first thing they did was say, no, I don't. Right? I don't have this. And I'm not willing to get any treatment. This is not my problem. Stay away from me. And how challenging it is for a family or even professionals to engage this person who really don't believe that they have this problem. And so there are a community of folks who suffer from this illness who truly believe that they may not have it. And why would you go to the hard work of treating something that you believe you do not have? And so what this tries, treatment tries to treat those ones who show up and are somewhat willing and admit that they do have a problem.
That's what I was getting at, a rather circuitous route, and that is the addict on the street. Is there someplace he can go or she can go to receive that help?
Right. So I would say the addiction treatment industry has been underfunded, overburdened for a long time, and the opioid epidemic has exposed those flaws and has created a larger gap for people to engage in treatment. The waiting lists are huge, unfortunately.
But my impression is that CAPA will have clinics.
CAPA will have a clinic.
A clinic, all right.
Right. It will start with a clinic. It's on Donica. Here in the city, and so there's an existing Preferred Family Health is the ones who has the existing clinic, and so we are partnering with them. So the Brown School could have either started their own clinic or embedded itself or partnered with an existing program.
You have a number of partners in this operation.
Right. So CAPA is about I arrived here in 2012. And so my research agenda was to figure out sort of the barriers and pathways to use and incorporate the best science, the best knowledge in treatment. And so to do that, I needed community partners. And so CAPA is really about gathering community partners on one subject, substance use disorder. And from that, there have been a lot of things that had happened, one of which is this partnership.
Well, how exactly does this work? How do you communicate and coordinate and work together?
Right, it's difficult. And so we try to stay in contact. There are some stronger partners more than others, and I would say in the beginning it was Bridgeway Behavioral Health, and they emerged with Preferred Family Health. And so we try to stay on top. I meet with the leaders. We try to stay up with the leadership and try to keep them abreast of what's going on in the latest science.
What is Preferred Family Health for those who don't know?
Right, so Preferred Family Health is the largest substance use disorder behavioral health provider here in Missouri. They're in a couple of different states. And so they have residential detox outpatient clinics sprinkled around Missouri.
So that's the connection to the abuser,
Correct.
the on-the-street connection, if you will.
Correct.
Right.
Yeah.
How do you explain this opioid epidemic? I mean, more people die each year of opioid overdoses than were killed in the entire Vietnam War, as I understand it.
Right. And so I'm in the middle of a book. Forget the exact name. I was like, the opioid epidemic in 3 acts. And so so it's complicated. It's complex. Yeah. I would say to boil it down into one thing, it's capitalism and greed. People could make money off opioids.
That's Big Pharma you're talking about?
Yes. Uh-huh. And they specifically targeted communities that they knew that would be open and that would use their product.
And to some degree, physicians were complicit because they were not shy about prescribing opioids.
I would say there's some bad actors who prescribe. And so hopefully the tide and the knowledge has turned to realize the effects of opioids, of these prescription. But there's still this idea that a person in pain should be treated, right? And when somebody shows up there, their primary care physician, and they say, I'm in pain, what's the primary care physician to do? Mm-hmm. And so the best, easiest, quickest thing to do is write a prescription.
Yeah, I want to correct myself, by the way. I said more people die each year of opioid abuse or of overdoses than in the Vietnam War. I'm talking about Americans killed in the Vietnam War, not the overall total. Well, this is a subject you know well, partially because you were an addict at one time.
Yes.
Tell me about that.
Right. So grew up in a home that trained me on how to drink and eventually use drugs. Cigarettes. I smoked cigarettes in 10 or 11 years of age, and also grew up in I would say a very violent home. So the conditions were ripe for a young man like me, and my father was an alcoholic, for me to be on that same path. So I'm a high school dropout. Eventually smoked marijuana, took drugs, and at age 26 wound up in a psychiatric hospital.
Right. You're Native American.
Yes.
Were you living on a reservation when all of this was going on?
No. So my people are from Kentucky, and during when I was young, and I was, and I want to blame my kids now, but so it's hard to be connected to their culture. So when I was young, I was more interested in doing all the wrong things, and so part of my family's Irish, the other part are Cherokee, and so the Cherokee people were good people, quiet Christians, and then the Irish side were, the typical,
Wait a minute, I'm Irish.
Right, and so it wasn't until I changed my life around that I came back around to the Native American side of my heritage, and so.
What is it about the Native American culture that has lent itself to things like this, alcoholism and substance abuse?
Well, so again, it's complex.
Yeah, sure.
And so and just think about this discussion you had last week, I think, the disease of despair, right? And so how this has become a thing. And let me tell you, there are communities that have been living with this for decades and generations. And I would say minority communities, this despair is nothing new to them. Social mobility, hope, all of those things, a good education. And so there are certain communities, and Native Americans, some of those communities suffer from the same things, just like other minority communities do.
I think I'm quoting you, and I think I am, with regard to the changing face of drug abuse. It has now gone from brown to white. Is that accurate, do you think? And if so, is that going to lead to perhaps more interest in solving the opioid problem?
Well, I would say it's not just me. I would say historically, opioids, heroin, drug addiction, when you thought about that, most times people thought about a person who lives in the street, and the face that come to mind would be a brown face. And the opioid epidemic, this is a different face connected to this. And so the face of this has changed. What used to be a criminal justice issue is now a public health issue. And the changing face, while it has brought the attention that this issue deserves, it is long overdue. And there have been a lot of communities that have suffered from the criminal justice position.
Well, I'm old enough to remember that it was Richard Nixon who declared a war on drugs. That's almost 50 years ago, and we're still fighting the war. And I think maybe one of the reasons is because the face was largely brown.
Right.
Right.
It's went from a war to we need treatment. Yeah. And that's what I would say part of the benefits of this changing face has changed our branding around this problem. We see it as a disease, a chronic health problem that needs to be treated, not imprisoned.
What turned you around?
So I would say a number of things. I had admitted that I had a problem, and I had people around me who understood this disease and used the latest methods to shepherd me along. And so I was young, and I was also suicidal, which, a lot of folks, when we talk about OD, it's hard to separate out what is an OD and what is just taking of your life. And I was also full of despair, had no hope. I was a high school dropout. I was a garbage man. And I couldn't see a vision forward, and the vision behind me was also not very well. So I was sort of stuck.
But there must have been some sort of an epiphany, some aha moment where you made the change.
Yes, his name was Ron McKiernan, first generation here from Ireland. He had been to prison 8 times. He was in charge of an EAP, Employees Assistance Program, at the garbage company where I worked. And he was a hardcore, hard-nosed person that had my number right up front and didn't let me sort of lie myself into a life of continued use. Yeah. And so he was a big part of this, to have someone in my life.
Could you just elaborate on that somewhat as to his tactics and specifically what he was telling you?
Well, I don't think they told me there's a delay here, so I can't cuss. And so he said his second language was vulgar. So I can remember one.
You're really putting down the Irish today, aren't you?
One time I can remember I was a garbage man on a garbage truck, and I didn't like the route I was on. So I had to meet with him weekly. And I had been in recovery 6 or 8 months, and I thought I had my life together and I didn't need any more help. I needed to get on the right garbage truck. And I was complaining to him that I was being mistreated. And he looked at me and he said, "David, you know who's more ignorant than you are?" And I thought, who? And he said, these son of a guns that hired you. You need to be grateful you even have a job. You need to go there, work, and it doesn't matter what truck you're on. Act like you're a good employee and forget about all this selfishness and self-pity you had. Get there and get to work. And those were the kind of like indirect messages that I needed to hear.
It sounds like it's kind of a tough love concept.
For him it was, and for me it was. But that model doesn't work with everybody, right?
Yeah, I was going to say and follow up with that because tough love might work, but if we're dealing with a mental issue, which essentially is what it is, that maybe is not the best approach.
Right, and the good thing that he had with me was he had a rapport, and he had what we call nowadays is a therapeutic alliance, and I trusted him. Right, and so I trusted him over psychiatrists. When he told me he'd been in prison 8 times, I was like, oh, I like this guy. And when I talked to a psychiatrist, I thought, I can't trust this guy. And so this is very important. This is part of this training that we're trying to do at the Kappa Clinic, is to train students on how to build rapport with people and how to build that trusting relationship, to have these hard conversations about not only changing certain parts of your life, you almost have to change your whole life. Right?
So what is the glide path for Kappa right now? I mean, you're relatively new. It's just getting underway, really. Yeah. Where do you see it, and how do you see it working down the road? 6 months, 6 years?
Right. So we have a cohort of 5 new students coming in this semester. And so we're going to have some specific training for them. And we're also going to do some workforce development for our current therapists. And so your listeners might be surprised to know that there are students who come out with a master's degree from the Brown School and enter this industry, and their first number in their annual salary is usually a 3. And they could have $60,000 worth or $100,000 worth of student loans. And so we have to make this more attractive to folks. So we hope to start one partnership at the Donica Clinic, and maybe there's other ones where other universities partner with local providers.
Do you think that your own story is a benefit, a big benefit in getting involved in Kappa and other programs?
I would say it doesn't hurt most times. What is also helpful is being connected to WashU. WashU has a nice brand, and so that opens up some doors as well.
Well, that brings to mind another question. It's a long jump from a garbage truck to Washington University. How do you make that transition?
It was difficult. It took a number of years. And so my general manager at the garbage company, every time he saw me, he says, "Why aren't you in college?" And I thought, "Are you crazy? I'm a high school dropout." And so I went to a program called vocational rehabilitation, and they did a number of tests and determined that I was dyslexic, had a learning disability, and the bottom line was I was mentally retarded and I wasn't college material. And so I was first clinically depressed, and then I got angry. And so I quit the garbage company, moved into Volunteers of America, and lived in what is essentially a homeless program for about 2 years, and went to community college and just went on from there.
The rest is history. Well, it's a great story you have, and a great project that you're involved with. God knows it's necessary. We have a big problem in this country, as you well know.
Thank you so much.
I want to thank David Patterson Silver Wolf for being with us. Again, our best wishes to you and to the Kappa Project.
Thank you so much.
Thank you. This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU.
Support comes from the Missouri Forest Products Association. Missouri produces wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details on the variety of products made in the state are at choosewood.com.